So I'm wondering, with the loss of ATS's mobile unit in Kalkaska County, is there any thoughts of maybe expanding to other locations in Kalkaska?
ATS had ATS lost a lot of their mobile services in all of the counties that we're in. And so we are beginning to see that impact on our mobile unit. So to answer your question on expanding to other locations in Kalkaska County, really what that boils down to is, we're mobile. We have wheels, so we can go anywhere. It might take more staffing and efforts to be able to do multiple locations in one day or in one week, but we are always open to the idea of moving locations to reach a broader group of people. So we are always looking for input from the community. And even we're asking patients that we see, where should we be? Where is the need? And really by asking those questions is how we find out um, where we offer services. So
Right. Yeah, most definitely. Rapid City is um, a place that's definitely needs services. However, there are other locations in Kalkaska County. We have 15 naloxone distribution boxes in Kalkaska County, and we man 11 of those boxes. And we have one of our locations that the boxes are used the most is actually Lodi area, which is south of Kalkaska, and then South Boardman area. So, yeah, and we have only one provider who offers medications for opioid use disorder, and he does not take Medicaid. So we don't have a lot of services in Kalkaska County. A lot of times people can't get to Traverse City where most of the providers are. So it would be great to be able to expand within Kalkaska County.
that is one initiative we're working towards is so Traverse Health Clinic and Munson Family Practice both offer, a recovery type program, medication assisted treatment in clinic. So we are in pretty aggressive talks and communication to try to figure out how do we bring medication assisted therapy onto the mobile unit safely, and how do we provide that care to patients in a way that is monitored and in a way that is reasonable for these patients who may not be able to make it to our clinics like our typical their program patients do. So
Yeah. I'm wondering if you could work with Kalkaska Medical Center, the hospital here, if there was any way you could work with them and park outside of the hospital.
is there resources at Kalkaska Medical Center that um or are there populations that are around that area of the hospital that would probably
I think there's a lot of populations throughout Kalkaska County,
Mhm.
but a lot of our providers are over at the hospital. So I know that I think ATS parked, I believe they parked at the hospital for a little while and at the health department. They were downtown for a little bit, but it wasn't as discreet, so they ended up moving. That was a couple of years ago.
Mhm.
So
What we found that really helps with this program is being consistent in a location for a while. And learning the community and understanding its resources and needs, and just being present and able to be counted on. A lot of times we talk about trauma-informed care and about being conscious and sensitive about the way that we present ourselves and talk with patients. And I think it's helpful when you're starting in a new community to have a consistent presence and to be there when you say you're going to be there, especially when sometimes funding changes and services are there and then all of a sudden taken away, that those experiences kind of build on that history of trauma to a person. And so we're trying to get to a place too, and for a little bit, build some of that that background so that people can know that we're there and count on us, and be able to predict when we'll be there when the rest of the life and schedule is a little bit sometimes unpredictable. So I think that when we start, and that's worked really well for us in Traverse when we started, just having being at the same spots at the same time, so people knew, like, okay, well, the bus will be here at this time, or they'll come out to the camp on these days. And I think that's really helped to build that. And we feel kind of like the new people in town, and so I think it will take a little while too to build some of that trust and have people know where to find us at a consistent time. It's a little tricky to be moving in a lot of different places at different times, because then how do people keep track of where we're at and when to find us? So I think our short-term goal is to build a little bit of that trust and presence in the community, and long-term goal, adapt what services we can offer based on what the needs are at that time.